Hello everyone. Welcome to our short video on why monitoring, evaluation, accountability, and learning matters. My name is Alex Naive. I work for Selanga as Community-Led Monitoring, Evaluation, and Learning or COLMEL advisor. Previous to working with Selanga, I served the Embrace project in the Philippines as M&E specialist. Most of my examples in this video actually come from the fresh experience of that project. In this session, there is only one question that we want to tackle. Why does monitoring, evaluation, accountability, and learning matter? Let's start off by saying that monitoring matters because it enables us to detect the change in the operating context. For example, by context monitoring, we determine that the level of access has worsened because of the emerging second wave of COVID-19 transmission, and that this triggered the government to reimpose border controls and tighter travel restrictions. Monitoring matters because it also enables us to map out and determine beneficiary reach. So we know who we are reaching and not reaching, and how many exactly from the women and men, girls and boys experience the change at the outcome level. Simply put, the beneficiary monitoring tells us how big the change is in terms of our reach to the target population. Monitoring matters because it enables us to show our progress and achievements, both physical and financial. In narrative and financial reports, we use monitoring data to tell our stakeholders how well we are doing in terms of delivery, spending, managing the risks, even how well we are doing in gender mainstreaming and other cross-cutting issues like governance and environment. On the other hand, monitoring enables us to identify our weaknesses, the challenges met during implementation, also the threats that undermine the project. Through the use of various data collection techniques, monitoring enables us to hear the voices of beneficiaries and intermediaries and determine how well our relationship with them fares. We learn about their praises and complaints about the project activities, or even the conduct of our staff, how the project activities can be improved to deliver quality results, and how they can meaningfully participate further in the project based on what they have and what they want to achieve through the project. Monitoring therefore provides relevant information to the right people at the right time to inform decisions. For example, findings from the context monitoring on the second wave of community transmission inform the decision of the managers to promptly reassess with the team the priorities and options to proceed while being compliant with do no harm principles and yet being able to deliver results in phases. Or the managers are alerted by problems that drive corrective measures for, say, the limited number of beneficiaries who show positive change in access to education services despite spending a lot of resources and devoting time for using several alternative strategies and actions. Or the findings of monitoring data give reason for the team to celebrate successes because the targets had been reached with high quality in less time and less costs, or that the stakeholders are really happy with the project but has very specific recommendations on, say, the length of knowledge sessions, how men and boys can be reached, or how to tap an existing opportunity provided by a government program. With the information available to inform decisions at different levels, the project is kept on track or moved back on track after being dislocated because of an impending risk, or a wrong assumption, a lapse in human judgment, or a generally flawed design. Use of monitoring data therefore makes effective managers, effective teams, and effective projects. Evaluation, on the other hand, matters because it enables us to see the big picture. It enables us to show broader achievements, such as effectiveness and efficiency, how coherence with other actors' intervention played a role, as well as long-term results, impact, and sustainability. Through evaluation results, we are able to conclude, for example, that the increase in the utilization of healthcare services and consumption of nutritious food by women and children have in fact contributed to the reduction of maternal and child deaths in the remotest islands in the Philippines. That a great deal of the contributing factors for effectiveness point to the strategies of efficiently using resources, money, talents, time, and good partnership for explicitly addressing the delays in making decisions to seek care, delays in reaching care, delays in receiving quality care, and in delivering nutrition specific, nutrition sensitive, and enabling interventions. Through evaluation, we are able to conclude that the impact of the project is really about the transformation of episodic practices into lifetime health seeking behavior and improved nutrition choices. That sustainability is highly likely because these positive behavioral changes persist even when faced with challenges and even transferred from our beneficiaries to non project participants in the communities. In effect, evaluation gives us the opportunity to learn, not to punish and cast judgments. It also enables us to use experiences from the project to improve the design of ongoing and future projects, policies, and programs. Ultimately, monitoring and evaluation matter because they enable us to demonstrate evidence-based results, both planned and unplanned. M&E enables us to learn and consequently make adaptations to our strategies, approaches, interventions, ways of working, even our organization based on evidence. With the use of M&E data, we are able to report to donors and head offices for upward accountability and enables us to communicate back to beneficiaries and intermediaries as part of our downward accountability for the resources we use and the commitments we held ourselves accountable to. While learning links well with M&E, learning by itself matters a lot. Let's begin by saying that learning matters because it enables us to discover and communicate what resides in the mind, to reflect on our work, and consequently contribute to program effectiveness and accountability. For example, while traveling by boat to reach an island community, there was a realization from a staff that maternal and child mortality are a reality to both poor and non-poor. Therefore, it makes no sense to continue our practice of targeting only the poor if we wanted to effect community-wide change in health behavior. On the other hand, the ADRA field app for output monitoring revealed an annual beneficiary attrition rate of 23%. Here, hard facts reinforce the field staff's realization to smarten up the targeting strategy. The realization from the staff and the revealing data from the ADRA field app informed the decision to target both poor and non-poor and to increase the target beneficiary by 23% to account for the attrition rate. Reflective learning also allows us to draw lessons in all aspects of the project, from how we frame our understanding of the community problems to how we understand concepts and principles relevant to the nature and scope of the project. For example, in one of the staff reflective learning workshops, there was a realization from a small group that severe acute malnutrition in children is tied to protein malnutrition. This revelation appeared after peering through the collection of monitoring data that showed limited amount of plant-based and animal-based protein in children's diet, including the diet of the pregnant and lactating women. From this revelation, the project added a sub-activity that was not originally planned. that is providing a type of chicken that is prolific in laying eggs and increasing the proportion of and seeds of legumes, pods, peas, and nuts in the kitchen garden starter packs. Reflective learning also matters because it enables us to review strategies and reassess priorities in view of changing circumstances without losing the overall direction or compromising our organizational culture. For example, the project team discovered that despite all the best efforts and substantial use of resources, the men consistently scored lower than women in the knowledge recall. Based on monitoring data, the men are kept busy in the farms or the seas in their livelihoods, so they miss out on the awareness raising sessions. Realizing that without clear practical strategies, the project cannot expect a reversal of participation patterns and performance levels where women participate more and score better than men. This hard lesson informed the project team's decision to make major adjustments in the ways of working to reach the men and improve their knowledge towards positive action. So the team conducted the radio programs, awareness raising sessions, and home visits on Sundays, compressed the number of sessions for men, but retained the core messages that needed to be recalled, even conducted the mobile theaters at night to reach the men. Individually, the staff from the supervisors to the field staff to the drivers and fleet managers had to accept the necessity of of the adjustment in the ways of working without affecting so much the work and life balance. Organizationally, the work days and off days had to be relaxed to compensate for the work done on Sundays, but respecting the Saturday for Sabbath. You can imagine that this led to discussions even at the country office level. The significance of learning born of reflection therefore begins with the knowing of lessons, of learning those lessons. But more importantly, reflective learning enables the realization of required change at the project design and delivery level, as well as the needed change in the self, the team, the wider organization, and the relationships in between. For the last piece, accountability matters because it enables us to explain what we have done, how we use the funds, and take responsibility for the results of our decisions and actions. Downward accountability, which is about being accountable to the people we aim to help, matters a lot because it enables us to work closely with the beneficiaries and intermediaries, and that makes us work effectively. For example, communicating back to beneficiaries and intermediaries helped our team discover the opportunity to use the community talents in mobile theater instead of paying a lot for professional theater group that is offsite. Later, they took interest in how we do M&E, so they requested us to engage them in participatory M&E that allowed all of us mutual gains. Upward accountability to senior managers and donors is also important because it motivates us to strive to be consistently responsible for making sure that money is used effectively. In summary, monitoring enables us to show that we are doing our work to meet our goals. Monitoring data help us tell our story to donors, beneficiaries, and intermediaries in words and in numbers. Evaluation enables us to see if we have in fact met our goals and made a difference in the lives of the people and community we serve. Evaluation is a way to learn from what has happened, look at it objectively, and use that knowledge to make informed decisions about the future of our work. M&E support learning and accountability because it enables us to learn so we can do better and also make us accountable to donors, head offices, intermediaries, and beneficiaries. With the significance of M&E and its link to learning and accountability, the call to action for everyone is to make M&E work not only for us, but also for other stakeholders. After all, the fruits of monitoring, evaluation, accountability, and learning should belong to all project participants. Thanks very much for your kind attention. Good day, everyone.